Hey, so borrowing my husband's scrubs here, doing this video here on health and safety tips when doing your hatha yoga or your asana yoga practice while being pregnant. And so first and foremost, the very most important thing with any exercise program or any activity that you choose to partake in when you're pregnant is you always, of course, want to check with your doctor or your physician, make sure that it's healthy and safe for you and the baby during your pregnancy. So once that's sorted and out of the way and you can go ahead and engage in activity, when it comes to yoga, traditionally you don't eat within 2 hours before you go to class, but being pregnant, you have a lot more blood and things happening and flowing through your body, so you do need to have at least a small snack, an apple, a cheese. If you can get protein in there, that's the best, because then you're a lot less lightheaded during the practice. And then also water. You want to make sure that you have water before and after your practice, and if you can have a water bottle or a small cup or something at your mat to sip on throughout the practice, that's great too. And if you're finding yourself chugging, that's a clear sign that you're pushing yourself too hard and you really want to back away from the activity that you're engaged in. You want to be sipping the water, not guzzling it, because you want to keep your core temperature down and keep you and your baby safe and healthy outside of that, again, yes, core temperature. You want to make sure that you're practicing in a cool environment below 72 degrees. Your doctor will even explain that to you. So things that are a big no-no are things like BIKRAM yoga. You don't want to be going into a room that's 104 degrees. That's, a surefire way to really have damaging effects between you and your child, and it's just not safe, smart practice at all when being pregnant. If you're worried about weight loss, plan better meals and things like that versus trying to go and overexert yourself in a high impact class like that. Outside of that, when you go into a yoga class, if you're doing more of a power style like what you've seen on my videos before, that's okay if you've already been practicing, and if your doctor says it's okay. But if you've already been practicing, you can generally just keep on practicing. I've been doing power yoga this entire time with my pregnancy. But if you're completely new to the practice of yoga, it's best to start off pacing yourself slow, just gauging your body, seeing how it reacts to movements and such. You don't want to just plow ahead into something strenuous right away, because again, that's not safe. When going into a classroom setting, they do offer a lot of prenatal classes out there in your hospitals and at different yoga centers and things like that. But if you can't find one, or if it's not financially feasible, sometimes they might cost a little bit more, if you go into a regular yoga class, you will be helped just fine. Just make sure that you dialogue and converse with your instructor. Let them know about your happy little condition, and they will take care of you. If you're not going into any kind of a studio, if you're just watching YouTube videos, then make sure that instead of just going through flow practices or hey, we're doing this pose, and then we're down here in this one, and then we're going to this one, make sure that you take the time to really study the individual pose tutorials that are out there, so that way you're practicing everything safely when you go through the flow videos. Other than that, then you're all set up and safe. Warning signs to completely back off and just stop exercising and either call 911 or speak to your doctor. If you feel a decrease in your fetal movement once you're that far along and you can feel the baby moving, if they stop moving or are not moving as much, that's a clear sign to back off. Call your physician, make sure everything's okay. If you experience vaginal bleeding, completely stop. Again, call 911 with that. Early labor contractions are always something to pay attention to, especially in your second and third trimester. If the uterine contractions are just happening too much and it's not something that you want to be doing. Sorry, it's hot in the room. Forgive me, I'm a little hot at the moment. But yes, other things to look out for are painful, hard veins in your legs or elsewhere in the body, pain, excessive pain beyond just the normal pregnancy aches that we all feel right now, but excessive pain in the abdomen or the back. And if you're having labored breathing, not like what I'm doing right now, this is just workout breathing, but if you're really choking to get some air and you feel like you can't breathe, definitely want to stop whatever activity you're in the middle of, and hopefully someone around you can call 911 if you're not physically able to at that time. Other than that, everything should be clear-cut. If there's anything specific with you and your pregnancy, your doctor will go over that with you. And once all of these are in check and clear, go ahead and practice the videos that you see on YouTube or go to your classes, and everything should be fine and dandy and great, and just enjoy the class, enjoy the experience, and have a good time. And if, just a little thing here, these are my little notes I've been staring at this whole time. I'm going to go ahead and put these bullet points in the details down below the video, so that way you can have a quick reference guide instead of having to watch this over and over and over again. If you're like, wait, what did she say? Was I supposed to eat a apple or fish or something for us? Oh, okay, right there in the notes. Got it. Good. So just things like that. So with that, I just hope that everyone has a good time. Enjoy yourselves. Be safe. That's the most important thing. Take care of you. Take care of your baby. And namaste. Have a really good day.